And now we're going to hear from Matthew Hardin. He's the Community Engagement Coordinator at MAGS. He has experience in community development, including rural LGBTQ drop-in programs, bullying prevention, partnership development, and child and youth counseling. New Brunswick native queer man, he is a strong advocate and passionate social justice worker, currently working on the unceded Algonquin territories now called Ottawa. He enjoys pizza and dogs. And joining him, we're going to have Joell Xavier, which is the bilingual support coordinator or the regional, for the regional community engagement. He has over 10 years of experience as a public sexual health educator, passionate about equity in access to healthcare and resources for LGBTQ and people. He has worked in harm reduction, HIV, STTBI prevention, and education, and KT to make research accessible to general population. Joell is also interested in community-led participatory research. Welcome you both.
Cue headset. And just so everyone knows, we will be doing this presentation in both languages, so you might need to put your headset on, take it off, maybe put it on one ear so you can know when we're transitioning from one to the other. Sans retard, on va commencer. Donc, bonjour tout le monde. Vous passez un beau matin à date? Ouais? Yeah! J'utilise mon temps précieux pour vous demander comment ça va. Faut vous répondre quand même. Non, c'est une joke. Donc, on va vous présenter un peu aujourd'hui notre région, comment on a un peu bâti notre travail qu'on va faire pendant les 5 prochaines années. Puis on va aussi vous présenter un peu qui Max Ottawa est, parce que je suis certain que beaucoup d'entre vous ne nous connaissent pas. Donc, on va commencer là. Donc, Max Ottawa, on est le premier organisme indépendant en santé pour les gars qui aiment les gars, qui est quand même significatif en Ontario. En 2017, on a rebâti l'organisme pour devenir Max Ottawa. On était anciennement un collectif appelé l'Initiative pour le mieux-être des hommes gays. Cette initiative-là était bâtie par des bénévoles dans notre région qui faisaient la revendication pour des meilleurs droits et des meilleures conditions de vie pour nos communautés. Et depuis ce temps-là, ben, c'est ça, ils ont été chercher finalement du financement en 2016. Et puis en 2017, on est vraiment devenu un organisme à but non lucratif. Notre région compose 1,3 million de personnes. Puis ça inclut les zones urbaines, banlieues et rurales d'Ottawa et de Gatineau.
Oh, cute. Notre région est un petit peu spéciale parce qu'on est vraiment sur une région frontalière. Puis historiquement aussi, c'était pour les peuples des Premières Nations, c'était aussi un lieu de rencontre, juste vu comment c'est bâti. Fait que Ottawa et Gatineau, les municipalités, c'est sur des territoires qui appartiennent à la grande famille algonquienne, mais c'est le peuple Omami-Wini. Puis encore aujourd'hui, la réserve de Kiligan-Zibi à 1 heure d'Ottawa-Gatineau n'a encore pas d'eau potable. Il faut encore qu'ils fassent bouillir leur eau. Fait que c'est quelque chose à prendre en considération dans le travail de décolonisation du travail de santé. Fait que, comme que Matt disait, notre travail, il faut toujours considérer le travail urbain de banlieue et en contexte rural. Puis c'est vraiment, vraiment, vraiment grand. Ottawa, c'est très grand, là. Ça a été aggloméré. Puis tu peux facilement conduire plus qu'1 heure, puis tu es encore à Ottawa. Puis si tu vas au bord de la rivière, à Gatineau, 1h30, tu es encore dans la même ville. Fait que c'est des grands, grands territoires. Puis nos communautés parlent beaucoup de langues, dont l'anglais, le français et l'arabe, mais il y a certaines réalités linguistiques qui sont différentes avec la région de Ottawa, Gatineau et l'Outaouais. Les personnes francophones, on est en contexte minoritaire, qui est différent d'autres régions comme le Québec. Ça fait qu'il n'existe pas en Ontario, à Ottawa, il n'y a pas de service de santé sexuelle pour les hommes qui aiment les hommes, ou même queer, qui sont vraiment en français. Il y a des fois une couple d'employés qui font comme du travail, qui sont bilingues, mais il n'y a rien qui cible les francophones comme tels en ce moment, puis on est quand même une grande population. Puis arabe aussi, c'est vraiment une population qui a un gros besoin de services, puis ils sont quand même pas mal représentés en nombre. Notre organisme offre des services dans les deux langues parce que c'est une réalité, puis par souci d'équité, c'est important pour nous d'être au service des anglophones et des francophones. Puis la diversité culturelle, ethnique, religieuse, spirituelle, etc. de la région de l'Outaouais, Ottawa-Gatineau, c'est une grande diversité comme la plupart des grandes villes comme Montréal, Toronto, Vancouver. Fait que c'est aussi une réalité qu'on a. Pour nos services, on a vraiment un focus sur l'amélioration chez les individus de la santé mentale, sociale, sexuelle, physique et spirituelle. I'll say it in English.
Yeah.
Okay, and for the people without earphones, yeah, I'm gonna do you a favor. So Ottawa-Gatineau is a special area. We're literally on the border between Ontario and Quebec, so that's like administratively and culturally. And an interesting place to work. So we are on unceded territory that belongs to the greater Algonquin Anishinaabe family, but more specifically, it's the Omamiwini people that are the original people that lived there. And not even an hour away from Ottawa in the reserve of Kitigan-Zibi, they're still under boiled water advisory. So it's just something to keep in mind in the work that we do. We have to work with urban, suburban, and within a rural context. Ottawa's huge. You're driving in an hour, you're still in Ottawa. You cross the river in Gatineau, you're driving, you're still there. It's very big. We have to, and we do work out of need for equity, do work in both official languages, English and French, and Francophone, so French-speaking people in the area. We're a linguistic minority, so we don't have access to queer space. We don't have access to LGBTQ and gay men's and sexual health services in French. It's extremely rare to find that, even though there's a large French-speaking population. And there's a misunderstanding that just because you speak French, you're white. It's not. There's cultural diversity within that language as well, especially considering the amount of people who land in Ottawa, landed immigrants, right? So it's similar to other big cities. There's a lot of great cultural, linguistic, ethnic, spiritual, religious diversity in Ottawa and in Gatineau. And our services do work that is on sexual, social, physical, spiritual, and mental health.
So I'm just going to say this green card is a clear no tea, no shade, by the way. But this is a clear representation of how we have to do our work in Ottawa in the same framework as everyone, but isn't representative of how we're supposed to be doing it. Just saying, okay? So I might take an extra minute because we still have a lot to go through. So just to remind us of the objectives, I'm like, no, but it's actually real though. So just to re-clarify the advanced objectives. So in our region, what we're hoping to do is to create stakeholder engagement, knowledge mobilization, to create community interventions, and also pilot them, and then also to create structural interventions and to pilot those as well. And the goal of doing all of those things is obviously to increase access and uptake to combination prevention services in our region. So obviously to do this, like other cities that already presented, we needed to assess where we were at in terms of our city. So we're just going to go over very quickly some data from our region. So, and I also want to recognize that while we are going to be presenting some data, this data isn't fully representative of everyone that lives within our communities, and there is a serious lack of representation of people of color, trans people, and two-spirit individuals, including Indigenous folks. So Ottawa Public Health has reported increase over the last 3 years in new cases of chlamydia, gonorrhea, syphilis, and HIV, with most new cases of the last 3 that I just named are among GBMSM.
The Sex Now survey showed that 51% of guys who responded had been tested in the last 12 months, which is not enough, obviously, especially considering a lot of people who could access these services downtown Ottawa. The Montreal Mobilize data tells us that shame and stigma and fees are the biggest barriers right now to that. And I guess on the ground is something that we see as well in Ottawa in terms of accessing services. 66% of guys who responded to Sex Now in 2015 responded that they were aware of PEP. And at that time, 58% of guys responded to the survey that they were aware of PrEP. So there's still a lot of education work to do on those subjects in Ottawa. We'll see what the most recent Sex Now results tell us. The Ottawa Hospital Survey told us that 1 out of 3 guys in Ottawa, so not Gatineau, across the river, report living with or having lived with depression. So that's a pretty huge number. And that 25% of guys are not out to their doctors, so they don't disclose their sexual orientation to their doctor. So that's also pretty huge for an urban area.
And while our community is slowly exploring the concept of combination prevention and are talking about exploring different prevention strategies, the concept itself of combination prevention isn't really talked about within our communities or isn't something that is used in the language of how healthcare providers actually talk. So it clearly indicates to us that there's a need there to connect the link for them and really make those words available as a theoretical framework. We also did an online survey within our own organization around substance use and chemsex. And out of 124 guys who were engaging in chemsex, 54% were only using in sexual contexts. And out of all substance users, 23% out of all substance users that responded to that survey, 23% declared being somewhat happy or not happy with their use. Sorry, there's missing words there for those who are reading the slides. So then we did some more community consultations. Obviously, we love some data, but the data doesn't give us the whole picture. So we did some specific community consultation. We had Dr. Dyke from our region actually write a report around Lit Review and put forward some recommendations around what research is telling us is working around these days. And then we also created our mental health partnership table that has been very informative in kind of guiding us in our mental health work within Max Ottawa. So some of the key recommendations that came out of those consultations was that there was high levels of mental health disparities within our communities, obviously. I think the other people also reiterated that. That one of the recommendations that was put forward was that we create a mental health navigation program, which we did. The importance of having inclusive and intersectional approaches, considering how Joel defined our region so great earlier. And then from the community to have diversity policies and procedures to ensure representation within our organization was something that came forward at a very early stage. And then also to increasingly engage communities that had been historically forgotten. So that included newcomers, queer people of color, guys who use substances and PNP, seniors, and then Indigenous and trans guys. I'm over! Okay, so we did a second round of community consultations. This first round was done when the organization was founded, so obviously it was in 2016, 2017. Then we got this amazing money to do advanced work, and we needed to reconsult with our community, so then we did a lot more stuff. I'm not going to go over it, but some of the key recommendations were ongoing consultation again, prioritizing a holistic health model. Our work needs to be assets-based, valuing, and celebrating our lives and our successes, and the strength of community building within our own communities, developing partnerships with usual and unusual organizations, PrEP access needs for trans guys, and then trends in the community of wanting to access financial health services, and having programs specifically targeted for aging folks, because in our region we also have disproportionately a lot of aging folks, and the importance of doing harm reduction work with guys who PNP. Reminder of the objectives. Okay, I'll go through it really quickly. Do you want me to go through it or no? Okay, I'm at 12 minutes, so I'm gonna go through it really quickly. So as the objectives state, we wanted to do stakeholder engagement and mobilization. So the way we're doing that is by creating partnership tables and bringing multiple stakeholders around our city to basically talk about some of the disparities that exist and how we can mitigate them. We're ongoingly developing partnerships, like I said earlier, with usual and unusual organizations. We have community trainee program in our region that their whole goal, they're hired within our organization, their whole goal is to work on projects that mobilize knowledge within our region. And then we have a CEC as well. Some of the community intervention development and pilot that we're doing is the community. Any of you attended my community maximizer presentation yesterday? Oh, sweet, hi. So we're continuously piloting new interventions that are, community and peer-led. And then we're also including priority populations. And then some of our structural interventions is working on combination prevention and harm reduction. I'm just going to leave it at that. Some of the challenges within our community. Thank you for letting me have 3 extra minutes of these other folks' time. I apologize to you all. Love you. If you have any questions, don't be shy to reach me.
Thank you, guys.